Hello everyone, my name is Thuy-Tien Ho. You can call me Tien. I am a PhD student in the Health Study program at the Texas Women's University. I'm doing a video assignments for my HS6483 program evaluation course. I will introduce and discuss about the Kirkpatrick evaluation model. I will first introduce the model's background and intended purpose, followed by discussions of its strengths, weaknesses, and application. According to Fry and Hammer 2012, the fundamental and intricate purpose of conducting a program evaluation for any educational intervention is to assess the understanding of the systematic and routine yet deliberate collections of data, to judiciously analyze the results in order to delineate what contribute to the success and/or failure of the program design, implementations, and outcome. The latter practice is to methodologically monitor and identify changes to determine what actions need to be taken to improve the quality and effectiveness of a measurable evaluation process. Conducting an evaluation may involve participants at many different levels. This may include, but not limited to, learners, educators, volunteers, administrative staff, researchers, other healthcare professionals, and a variety of internal and external stakeholders. The appropriate participant should question and assess for the essence of change, either intended or unintended, within the variations of the evaluation process. So, what is the purpose? In fact, a robust program evaluation process must not only support the existence and accountability of the program, it also must permit the program developers to prove the purpose and worthiness of the educational intervention to the target population. This is most often done to sustain resources and funding for the ongoing operation and development of the program. Within the latter context, public health program developers and evaluators must apply the concepts that Fry and Hammer 2012 recommended. To prudently choose a strategic evaluation model or theoretical framework that not only methodologically examine for both desirable and undesirable changes within the program, but also to measure and interpret the relevance and effectiveness of the intervention outcome. Therefore, I want to introduce to you the Kirkpatrick evaluation model. The Kirkpatrick evaluation model was originally written as the PhD dissertations of Dr. Donald Kirkpatrick in the 1950s. For more than 3 decades, this conceptual framework has been served as the industrial standard and considered as the most popular method to evaluate educational training program. According to Fry and Hammer 2012, the model was set up to guide the collections of data by dividing this process into 4 hierarchical levels: reaction, learning, behavior, and results, to measure the training program outcomes. This is the demonstrations of the Kirkpatrick model from level 1 to 4. This is a better visual demonstrations of the 4 levels of the Kirkpatrick model. Level 1, reaction at the very top, measures the participants' initial reaction to how well they enjoy the training program. This is in terms of satisfaction with the material quality, the instructor, and relevancy or insights of the educational intervention to the individual's field of study or professional practice. Level 2, shown in yellow, learning, which qualifies as the learning outcome by measuring the participant's ability to absorb the educational contents being taught. Then direct this to the particular learning objectives of the individual or program. Level 3, here in green, known as behavioral, measures the participants' change in attitude and behavior outcome. This includes knowledge and skill acquired during the training in addition to how well the participants apply the learned material into their daily practice or profession. Finally, level 4, which is the results. This level measures and analyzes the impact of the educational intervention at the business or larger organization level. In other words, this level measures the participants' understanding in applying the learned material at the business level. Furthermore, the intended purpose of the four measurable outcomes of the Kirkpatrick model was constructed also in part to justify the financial entity or cost-effectiveness of the program, once again, at the influential business and larger organizational level of operation. The Kirkpatrick evaluation framework has been recognized due to its multitude of strengths. For example, it demonstrates the necessity for training professionals to conduct a systemic evaluation with straightforward approach about their training program outcomes. It provides access to information for educational programs to reach their goals with implication at the larger organizational context with a practical business application. Moreover, according to Fry and Hammer 2012, the model's major contributions to education evaluation are the clarity of its focus on program outcomes and its clear descriptions of outcomes beyond simple learner satisfaction. Within the model's simplicities of construct and ease of application for the evaluators, Bates and his colleague 2004 conducted a critical analysis of the Kirkpatrick framework to show its various limitations, which are the model's weaknesses. For instance, the fundamental limitations of this model includes its incompleteness to evaluate the effectiveness of the education intervention due to its simplicity. The model also assumes the causality between the educational program and its outcomes, which is a reflection of the reductionism theory of linearity. According to Bates and colleagues, another advantage in using this model is the evaluator must also assume the increments of the importance of information as the levels of the training outcomes ascended. Bates and colleagues also demonstrate how the model's incapability to effectively address both the summative questions, was the training effective, and the formative questions, how can the training be modified in ways that increase its potential for effectiveness? These lead to the limitations of the training and human resource development professionals to fulfill the core ethical duty of beneficence. Abdel and colleagues, 2018, used the Kirkpatrick conceptual framework to evaluate the effectiveness of training program outcomes in conducting a hypertension educational intervention for the accredited social health activists, also known as ASHA, who live in the rural regions of South India. The three objectives of the educational interventions are: 1, to create patient education materials to help participants recognizing this disease in order to minimize disease progression. 2, to document the process of training the workforce. And 3, to measure the effectiveness of the educational intervention in the context of measuring the participants' understanding, skills, and insights of the workforce utilizing the Kirkpatrick evaluation model. The purpose of the program is to alleviate the prevalence of hypertension outcomes for those who live in these communities of India. The 3-month educational program is part of a cluster randomized feasibility trial comprised of 5 days training workshop with interactive instructional strategies to provide detailed education and establish goals relating to the management of high blood pressure to 15 participants. The intervention also showed the participants how to measure their weight and blood pressure. In addition, the program facilitated group meetings for participants. The Kirkpatrick evaluation models was used to evaluate the training by assessing the reaction, learning, behavior, and results using tests on knowledge at baseline, post-training, post-interventions, and also observations of performance during meetings and post-intervention interviews. The study shows that the study subject knowledge of high blood pressure improved from an average of 64% at baseline to 76% immediately after training to 84% 3 months post-intervention. Research officers who witnessed the group meetings stated that the ashas conveyed the self-management content successfully without additional assistance. The ashas claimed that the training materials were easy to comprehend and beneficial in educating the people who live in the community. Abdel and colleagues implied that the maternal and child health workforce can be trained to lead community-based group educational discussions and also to support individuals for the management of high blood pressure. To summarize, there are many health and/or evaluation models available. The Kirkpatrick evaluation model has proven to be an invaluable framework, with the literature providing countless use of this model since its development. Health educators and healthcare professionals must select the evaluation or logic model that is most fitful to their specific circumstances or health issues to attain the highest gain from these models. This is to ultimately reach the program's most influential outcomes. These are my references. Thank you for listening to my presentation.